Hello and welcome to the Keep It Local Maine podcast, where we tell the stories of local business owners and Maine residents and learn more about what they do, who and what inspires them, their challenges, successes, and more. My name is Todd Regalinski.
And I am Kimberly Regalinski.
And we are the publishers of Keep It Local Maine, a local magazine that helps showcase local businesses to the people in and around their communities. Thank you for tuning in to our weekly podcast that you can subscribe to on Podbean, Apple Podcasts, and Spotify. You can learn more about us at keepitlocalmaine.com and follow us on Facebook, Twitter, and Instagram through the links in the show notes.
This episode is sponsored by Fabian Oil, a family-owned and operated business that offers heating oil and propane delivery, services, and repairs. Fabian has been serving central and northern Maine with propane and oil for over 30 years. As a local Maine business, they cherish the relationships they have formed by serving the people of their communities. In 2019, Fabian entered the southern Maine region with a heating oil acquisition, and they have recently brought propane to the market. They are aggressive and would love to be your supplier. Give them a call at 207-793-2044 or visit fabianoil.com.
In this episode, we'll be talking with Cheryl Tucker and Julia Bachelder from Maine Cancer Foundation. Julia joined the team at Maine Cancer Foundation in 2016, where she oversees major events and offers participant support to fundraisers. Julia is a native of Yarmouth, Maine, and past participant in Try for a Cure. She loves the opportunity to support women who endeavor to challenge themselves while also fundraising for a meaningful cause. Cheryl joined the team at Maine Cancer Foundation in 2019. She has spent much of her career working in cancer-related public health. As a passionate advocate, she strives to ensure that cancer prevention, screening, and care are prioritized in all of our Maine communities. While she is not a native Mainer, she calls Maine home and can't imagine living anywhere else.
Well, welcome to the show, Cheryl and Julia. We are so glad to have you here with us today.
Well, and thank you for having us. We're thrilled to be here.
Yeah, this is fun.
Can you tell us a little more about Maine Cancer Foundation and how it got started?
Sure. I can tell you a little bit about Maine Cancer Foundation. I mean, first and foremost, our mission is to decrease cancer incidence and mortality in Maine. And basically what that means is we want to make sure that fewer people hear the words, "you have cancer," and that fewer Mainers die from the disease. You know, cancer is the number one cause of death in our state, and our goal really is to change that. We are a public foundation, and basically this means that we raise all the funds that we then invest back into Maine communities. 100% of our funds are spent fighting cancer right here in the state.
Wow.
Yeah, I mean, we were established in 1976, so 45 years ago, been around for quite a while, by a small group of concerned Mainers who had lost loved ones to cancer, and basically they felt compelled to make a difference. They noted that there wasn't another organization that was 100% dedicated to helping and protecting Mainers from the disease. So from there, they created Maine Cancer Foundation. So, yeah.
45 years.
Yeah. I don't think a lot of people know that about us, but yeah, we've been around for quite a while. The foundation's initial focus was on funding cancer research in Maine, along with some oncology provider education and patient support. It was in 2015 that our board of directors voted to transition our focus to areas that they felt Maine Cancer Foundation could have a greater impact on the health of Mainers related to cancer. So we launched our Challenge Cancer 2020 initiative and really focused our efforts on funding grant making on three primary areas: preventing cancer in Maine, screening for more cancer in Maine, so finding it earlier when it's often most treatable, and improving access to care regardless of someone's income or geography. So we just wrapped that up in 2020, and through that initiative, we invested over $15 million in Maine, awarding grants and providing programming and coalition building across the state in all 16 counties. So that's really Maine Cancer Foundation in a nutshell. Moving forward, we're continuing our focus on cancer prevention, cancer screening, and access to care in our great state.
Oh, that's great.
That's such a huge number for me to comprehend across just a state like Maine that has been invested. That's incredible.
$15 million, yeah.
Well, you know, honestly, we raise all those funds through our community events. So frankly, we couldn't do it without the state of Maine, without our event participants, our sponsors, and all of that. So it's been a real community effort making this impact in our state.
That's great.
Wow. So how did both of you become involved with Maine Cancer Foundation?
I can speak to that first. So I actually did Try for a Cure as a participant back in 2011. So that's how it first kind of came on the map for me. And I have a background in events, working for a marketing agency. And, like so many, if not every Mainer have been, my family, my friends have been impacted by cancer. So when the role of events manager, MCF, came up, it was a job that's combining my love of endurance events. I had participated in the tribe, believed in it as an event, and obviously the mission resonates with me. So I've been so fortunate that it's really been a perfect job for me.
That's great.
Yeah.
Yeah, and I can speak to that as well. So I've been working in cancer-related public health for over 20 years in the state of Maine. And, when the opportunity to become a part of the Maine Cancer Foundation team came up, I just felt like it was a perfect fit for my personal and professional goals. Kind of like Julia mentioned, I've had many family and friends in my life touched by cancer in some way, whether a diagnosis or, just they knew somebody. And frankly, working for Maine Cancer Foundation allows me to focus on this cause of fighting cancer that I'm truly dedicated to. So it was a perfect match.
Yeah, that's great. So how can people get involved with your mission?
Well, they can do a number of things. Obviously, they can get involved with our events and programming efforts. We actually host a cancer coalition called Maine's Impact Cancer Network, where folks who are interested in, getting involved across the state, we're always inviting them to join us in that group. But, one of the most important ways that someone can become involved with our mission is to talk with their doctor about their cancer screening tests, wear sunscreen. If somebody is a smoker, they can talk to their doctor about, how can they quit? Really paying attention to their health and trying to reduce their risk of cancer and the risk of those in their life. So that would be maybe my biggest message about how to get involved with our mission. And Julia, I know, can talk a little bit more about how to get directly involved with some of our events, which fund our important work.
Yeah, so that leads nicely into talking about Try for Cure, which is our upcoming triathlon fundraiser. Try for Cure was founded in 2008, and since then it has raised over $17 million, which is really incredible when you think about how many women and donors it's taken to get to that number. Typically, it's hosted at Southern Maine Community College, which is the most beautiful venue to host any sort of event, and has 1,300 women lining up. Obviously, things have changed a little bit the past couple of years, and this is going to be our second year as a virtual event. But it's actually, when we had to transition last year to making this event that's usually, this huge scale all women event into, a virtual event, we were still a little bit skeptic. We didn't know if people would be enthusiastic, and we were blown away by how people really embraced the format. And instead of seeing one triathlon, we saw hundreds of triathlons all over the state. So while we had hoped that 2021 would be a return to in-person, we have again just been amazed by how these women are still so eager, which really speaks to the cause. So we are definitely encouraging participants to register still. The event this year is July 1st through 18th. And again, it can be done anywhere. It can be done as a relay. So you can, grab your sister, your friend, your coworker, or you can do the whole thing, all three legs. And it's at your own pace, in your own place. And we are all about community at Try for Cure. And the event is so much more than a race. It's about bringing women together. And it's been really neat to see people continue to do that despite not being physically together.
Right. So anyone that wants to get involved in that this year can participate. So whether you're a first time, they can kind of do it at their own leisure. It sounds like someone, a beginner, or, whether for beginner from someone that's a professional, triathlete. Exactly. It sounds like it allows for everyone to be involved, right?
Yes, which has actually been, we were surprised by how many women participated last year. It was their first time doing it, and said that, this is actually a great way. I've been nervous to do Try for Cure for so many years because I'm intimidated by swimming in a big group of people and getting kicked in the face. And I don't know if I can bike 15 miles. So, being able to do it virtually means that you do have freedom to, as you say, take it at your own pace. And, if you're not comfortable swimming in the ocean, you can swim in a lake or the pool even. So, it is wonderful how we do have, we have women who who do Ironman triathlons, who take this very seriously, but even more so, they take the fight against cancer seriously. So it's very much a unifying event and brings together women of all abilities and all backgrounds. And it's, as I say, it's just been really neat seeing people make it their own.
That's great.
I think that might have been the first time ever anyone has ever mentioned triathlon and leisure in the same sentence. I just want to note that down so that you can mark that in your diary, Kim, because I don't know that that's ever happened before, because when I think of a triathlon, I'm certainly not thinking of leisure.
Well,
Not unless it's maybe the 1970s and someone who's wearing a leisure suit while officiating. Other than that, I don't think so.
When I totally believe in your mission, and I'm definitely not a triathlete. But when you said triathlon and leisure, a light bulb went on for me. I'm like, oh, maybe I can do this.
Yeah, which actually is a good question. Like, now, what is because I am, well, you can't see me here, but I am obviously not a typical triathlete. Yeah. But what does a triathlon entail? Is it, I don't know if there's a standard like distance for all the things in that, or what is the Try for Cure exactly?
Yeah, there are different distances and standards, and we are a USAT sanctioned event. So we are what's considered a sprint triathlon, which means the women do a 1/3 mile swim followed by a 15-mile bike, and then they end it with a 5K, so a 3.1 mile run. And the Try for Cure is, so, as I mentioned, it's more than a race. So, a lot of times you go to triathlons and they're just full of these, super athletes who are incredible. And Try for Cure is really more about, the hugs at the finish line, the high fives. We have women who have been known to, in the middle of the race, stop because they see another woman walking, and they walk with that woman, and they share stories about why they're motivated to try. And so when we're looking at the public health scene this year, and weighing, could we potentially do a triathlon? And we're seeing that races are happening this year. Road races are, if they're limited to a certain number of people, and everybody is distanced. And that's not what our event has ever been about. It's not about getting people to hit certain times and get through the finish chute and then pack up and leave. Ours is really about the human connection. So without being able to do that, it wouldn't be the same. So that's why we've a big driver of why we have continued to really push the virtual format.
That makes total sense.
Yeah, it does make total sense. And it seems like it just from just even a personal... Sorry.
It's all right.
My mom passed away.
Oh, I'm so sorry.
I knew this was going to happen today.
We're all about tears at Try for a Cure. We're very used to this.
Yep.
It just seems like, this virtual format too, it just seems like it could be something, that you could gather with some girlfriends or family members and say, I want to honor my mother this year. I haven't been able to participate in the past, but, this is something that I could do, that I could grab some friends and, participate in this. So it's really cool that you have had to shift because, like I said before, it gives an opportunity for people that may have never participated.
Yes. And it's given people more flexibility to make it special. So not only do people have flexibility in terms of the, athletic portion of it, but last year we saw women, they picked a bike route that went past a graveyard where a loved one was buried, or they ended their race at, the hospital or the care center where a family member has been receiving care. So there's so many ways to make it moving. And yes, I think especially compared to last year, this year there is some more, I think comfort level for people to be able to safely do events with a small group of friends or family members. So we're really excited to see, how people make it meaningful. And this event is a fundraiser first and foremost, but it's also a huge catalyst for people in their journey, whether it's as a cancer survivor themselves or as a caregiver or grieving a loved one. So we're really glad that it can continue.
That's awesome.
I think you'd look great in a swim cap. I'm just throwing it out.
Yeah.
Now, the one question I have is the fundraising aspect of it. Does it solely come from people paying the entry fee, or do people get others to pledge them for their participation?
It's what we call a peer-to-peer fundraising event. So people do pay a registration fee. There's a $50 registration fee, and I keep saying typical year. So pre-pandemic, when we're in person, we have a fundraising minimum. So in order to participate, you have to you're committing to a triathlon, but you're also committing to a fundraiser. And because of being virtual and the flexibility, we are able to remove that fundraising minimum, and we do have you're not committed to fundraising, but you have to hit a threshold of $250 to get your shirt and medal. And we have all sorts of incentive prizes along the way to encourage people. And we were amazed last year, even in a pandemic, the average participant raised close to $1,000. So
awesome.
Wow.
That's definitely the bulk of it. We also have an amazing team of sponsors. WEX is our presenting sponsor. They've been with us since the beginning, and a whole host. We have so many of them came back, small businesses, big businesses, most of whom have been affected by the pandemic in some way. And I think it's a real testament to the importance of our mission that people want to make this a priority even in difficult times.
Yeah.
Yeah.
That's awesome.
Yeah, and it just what a great way to honor those people too that have passed. Just an opportunity to do that.
In terms of what you've been doing, obviously things have been very different for people over the last year and a half. What would you say is the biggest lesson for both of you that you've learned in the past year, or maybe the past couple of years, doing what you do?
I can jump in on that one. Just initially, I think the biggest lesson is that many of us have learned, frankly, is to be flexible. Right. We've had to, as everyone has, make significant changes in our work, in our personal lives and such over the last year. One of the things that's been really wonderful about being a small organization like Maine Cancer Foundation, with that flexibility, we've been able to take a look at things that we might be funding or efforts we're making and shift. So like last year, for example, we were able to shift some of our grant making when, for example, cancer screenings took a shift and people were not going into the hospitals for good reason to get their screening tests. We were able to shift some of that funding to addressing the needs of cancer patients in a pandemic. All of a sudden, transportation was harder to get to. You might remember when getting hand sanitizer and masks was almost impossible. So we were able to partner with some organizations and shift some of our work to make sure cancer patients were able to have what they needed to be in the community or to get to their cancer treatment appointments. So I think biggest lesson maybe for me in the past few years is that flexibility piece, and to just take a breath. And also to just never underestimate the passion of so many that have either battled cancer or have supported someone with cancer, because frankly, we couldn't do our good work without people that have supported our mission. And last year just knocked our socks off with how people rallied around Maine Cancer Foundation and our mission. So that would be my answer to that question.
Yeah. That's great.
And I think I would actually piggyback on that. Just, I mentioned that when we made this transition last year and faced the reality of having to host the Tri virtually, I thought, people, they don't want to do this. This is just another virtual option out there. And so it's really, the commitment of Mainers believing in the cause and just how important that it is that people continue to prioritize supporting Maine Cancer Foundation, supporting fellow Mainers. We like to say that we're Mainers helping Mainers, and it's never been more true than this past year.
Yeah, that's great.
Yeah.
So one of the things that we'd like to ask, and we're just always curious about, is how would you say you define success? What does success look like to you?
I mean, I would say, frankly, I'm going to speak to it from the organization, but like I said earlier, I mean, I do this work for personal and professional reasons. So, success for me is knowing that patients are getting the treatment. I mean, if we as Maine Cancer Foundation are raising enough money to give money back out to communities to ensure that person that's, 2 or 3 hours from their cancer treatment center can get there and can get through their treatment, to me, that's success. It's almost one person at a time in some cases. When I see cancer screening rates rise, that feels like success. But it takes time to see these benchmarks sometimes. But I think that's how I would define it, making a true difference in the lives of Mainers.
And I would, from my perspective, success to me is it's sort of twofold. It's walking this balance of hosting an event or organizing an event that is a successful fundraiser, but also delivers a rewarding and inspiring experience for the participants. And, similar to what Cheryl is saying with it's, maybe one case at a time, one person at a time, it's receiving an email from somebody explaining why this event meant so much to them and how it helped them in their journey. That's really that success for me. It's these little stories. And that's what we always say. That's what makes the Tri special is it's each one of these women that brings a unique perspective.
Mm-hmm.
Yeah. And that's so important because, as you've said, it's very rare to find someone who isn't touched by cancer in some way, shape, or form, and that making that connection personal is huge.
Yeah, for sure.
Another question that we always like to ask: who or what inspires you, either personally or professionally?
So I can speak to that. It's interesting. I was rehearsing for this in my car this morning in preparation for our conversation, and I just keep coming back to, for me personally, I think what started me on the journey in this cancer fighting arena, my husband was diagnosed with cancer, over 30 years ago. We're so blessed that he's a survivor, and there are a lot of things to consider. But since that time, many people, as I mentioned earlier, in my personal life, have been touched by cancer. And when I broaden that and I think about Maine and I think about all the people in our state fighting cancer or who've been touched, that inspires me. We're the most rural state in the nation. We have the oldest population in the nation. We have huge barriers to getting to care. And so honestly, that inspires me to go to work every day and figure out how we can truly make an impact and make things just a little easier, because the cancer journey, as I think we've all alluded to, is not a simple one. So if we can ease that burden in some way, that inspires me.
Yeah.
And for me, I think, it might seem obvious, but the women who do the Tri, and whether it's somebody who's done it all 14 years or it's their first time, every single year I cry at the finish line when when we're in person and I see these women crossing, whether they are, the first one across the line or Meredith Strang Burgess, who's our official last place finisher every year. Just knowing the perspectives that people bring to this and the challenges that they've overcome to get there, and I broaden that even more so this year, where it's being a human is difficult, and this year has presented so many more challenges and made it even more difficult to human, if human is a word, and so whether it's our event participants or just the people that I meet on the street, the fact that people, watching people pull together to, get through these challenges. I've definitely had many challenges this year, but also no shortage of inspiration.
And I totally think that humaning could be a verb.
Right? I know, I like that.
Granted, nobody is asking me to teach high school English. I can't even tell you what a gerund is, but I'll allow it.
Perfect.
Consider that your doctor's note to use that in the future. And
Oh, wonderful! Adding it.
It really truly is inspiring to us with what you do and just your mission, and to watch just even the events that you guys have put on over the years. It truly is inspiring. It's just beautiful. And we live in such a beautiful state, and we are so lucky to live here. And I always like to ask, what is it about Maine that you love? What is the favorite part of living here in Maine, would you say?
Go ahead, Julia. I was just going to say, I love our coastline. I love our Maine summers. We have kind of a rule in our house: you can't leave Maine in the summer. Why would you?
Right.
And then, of course, I feel like we are so blessed to have a national park within our borders. I love Acadian National Park. And so that would be my quick answer to that question.
Yeah.
Yeah, I think if you had asked me this question, a little over a year and a half ago, I probably would have started talking about our restaurant scene and all this. And I still love our restaurants. I can't wait to be back, but I've never been so happy to live in Maine as during the pandemic, because we have access to these, as Cheryl says, the national parks. We've got mountains, we've got ocean. All of it is in such quick reach, especially for us here in southern Maine. So just the ability to get outdoors safely, not being in a city, a big city at least, it's been a real gift this year.
Absolutely. Yeah, I would agree for sure. Yeah. It has made, what was that word that we said?
Humaning.
It has made humaning easier.
Yes, it has.
And anything that makes humaning just a little bit easier, that gets a thumbs up from me.
Yes.
Yeah. Okay. In my book.
Yeah.
Well, Cheryl and Julia, thank you so much for joining us today. We appreciate your time.
Yes,
we appreciate you sharing
absolutely.
your stories. One question I would have is there a deadline for registration for Try for Cure this year?
It's a rolling deadline. We're not limited by capacity, so we want anyone and everyone. All women should head over to tryforcure.org, and at least through the end of June, we will have registration open. So we haven't set a close date, but I would say get registered now so you can begin training. As much as it is, it's definitely flexible. You want to make sure you get your bike out of the garage and dust it off and tuned up, and also give yourself some time to fundraise. So sooner the better.
Yes. Start hydrating and stretching now.
Yes.
Maybe I'm just saying that as someone who's over 40 now, and that,
It's never too early to carbo load.
well, that's been my problem all these years. I've had no problem with that part of the training. It's the other stuff that seems to be a little difficult for me. But I will be sure that we put a link to the registration in the show notes, as well as a link to Maine Cancer Foundation's website and social media pages. Once again, thank you so much. We really appreciate the work you're doing.
Yes,
and
thank you.
Wish you great success with this year's event.
Yes, absolutely.
Well, thank you for having us. We appreciate it.
Thank you.
Have a great day. Thanks again.
Thank you again to our sponsor, Fabian Oil. Be sure to contact them for all your propane and heating oil needs using the information in the show notes. And thank you for listening.